Imagine the terror. A child's life hangs in the balance. A medical emergency demanding just one thing: blood. But for countless families across Nigeria, this vital lifeline is often tragically out of reach. Their desperate plea for help is met with the crushing reality of empty blood banks.
I have two children born with sickle anemia. For one of them, the crisis comes more frequently, like every month, and they are usually very severe. She goes into very severe pains that cannot be managed at home. So usually we have to go into hospitals where they are managed by with pain medications. It's usually very difficult to get blood in a public hospital.
Lives are being lost because of the shortage of blood in our healthcare system. In Nigeria, with 220 million people, we should have 2.2 million Nigerians donating blood regularly to be able to meet the blood requirements to save lives. But as at this moment, I think we are still collecting less than 500,000.
I remember one occasion where one of my girls, she had blood transfusions, yes, but unfortunately she caught a hospital-acquired infection. And in the middle of the night, her blood level just crashed. There was no blood in the hospital where we were.
Unfortunately, we have to depend on family replacement donation. That means people who are sick and are already distressed in the hospitals, needing to have a medical intervention, have to bring in their family members to come and donate blood before they can have blood transfusion. And you can imagine that woman who has a child with cancer, whose child needs blood transfusion, and you are asking her to go and donate blood. Or that patient with sickle cell disease who is in severe crisis, the family is distressed and are also in pain because their family member is in pain. And you're asking them, oh, your son or your daughter needs blood transfusion, go donate. That is usually an inappropriate time to ask people for donation. But unfortunately, that is our current practice in the Nigerian healthcare systems now, asking people to go and donate blood because their family members needs blood.
This heart-wrenching reality we witness in our hospitals often boils down to a single critical challenge: finding enough willing hands to give. In a nation brimming with vibrant life, the act of blood donation remains steeped in a cloud of misconceptions and daunting fears. Why the reluctance to donate, one might wonder?
I've done it once, but I don't do it again because I have this belief that it shortens lifespan.
As for me, I dey fear to donate blood because if I donate, I no go get any blood for my body. That's why I dey fear for myself, for my own. No.
I used to be scared. I know they donate blood. Doctor say woman know they donate blood. If a woman donates blood, you faint.
It's usually very difficult to get blood in a public hospital.
people who are healthy between the ages of 18 and 65, who can walk into the hospital blood banks to give their blood to save these lives. This is the best form of blood donation. It has been proven to be the safest form of blood donation. For every unit of blood that we collect, we have to ensure that it is free from HIV, it is free from hepatitis B, it is free from hepatitis C, and it is free from syphilis at a minimum. We have to give specific blood group to specific patients. We cannot give blood group A to blood group B. So we have to test the donor's blood group, we have to test the recipient's blood group, we have to cross-match and be sure that it matches. That is what people pay for. There is this misconception that women don't donate. That is not true. I am a blood donor and I donate blood 2 to 3 times a year. And I've been doing that for more than a decade.
So Daniel, how do you feel doing this incredible kindness for this random woman you met at the hospital today?
I just finished donating blood and I'm happy to save a life. Thank you.
When I eventually get blood, of course, I'm happy. I'm really, really happy, because it's like a lease of life for my girls.
So a donor has been found, blood has been given. What next?
Having one's child in such severe pains, there really isn't anything you can do to help. Personally, it makes me feel really terrible.
I am ESOSA and I am a sickle cell warrior.